EKGs can give us a lot of different clinical information about our patients. One important area of EKG interpretation is recognizing signs of ischemia and myocardial infarction. When we look at a standard EKG, we see that the EKG is divided into 12 leads. These leads give us different views into the heart. Even though the 12 leads are looking at the same heart, by looking at the heart through different leads, it allows us to get a different view of different aspects of the heart. This is analogous to looking at a house through 12 different windows. If we look at a house from one direction, we get a certain perspective about what's going on inside that house. But if you look at that same house from a different angle, we get a very different impression about the appearance of that house. So even though we are looking at the same house, by looking at that house through different windows, we get a different perspective on what's going on inside the house. The same is true with the heart. By looking at the heart through 12 different leads, we are able to get a different perspective on what is going on in different walls of the heart. The 12 leads are divided into two categories: the limb leads and the precordial leads. The limb leads are obtained by placing the leads on the patient's limbs. The limb leads are named leads 1, 2, 3, AVR, AVL, and AVF. The precordial leads are obtained by placing leads across the patient's precordium. The precordial leads are named V1, V2, V3, V4, V5, and V6. V1 begins just to the right of the sternum, and it continues across the precordium to V6 in the anterior axillary line. The nice thing about an EKG is that the leads are always arranged in the same order. The limb leads are always first, followed by the precordial leads. The different leads give us information about different walls of the heart. Leads 2, 3, and AVF look at the inferior wall of the heart. Leads V1 through V6 collectively look at the entire anterior wall of the heart, but we break these down into subsections, where V1 and V2 look at the interventricular septum, and V5 and V6 look at the lateral wall. The other leads that look at the lateral wall of the heart are leads 1 and AVL. So the lateral leads are leads V5, V6, 1, and AVL. Here's what it looks like on a real EKG. Leads 2, 3, and AVF look at the inferior wall. Leads V1 through V6 collectively look at the entire anterior wall. We break them down into subsections, where V1 and V2 are the septal leads, and V5, V6, 1, and AVL are the lateral leads. So, when you are looking at an EKG for signs of ischemia or MI, look at the leads for each wall together. Look at leads 2, 3, and AVF together. Look at leads V1 through V6 together, but then look at V1 and V2. Then look at V5, V6, 1, and AVL together. The waves on an EKG are given names beginning with the letter P, followed by Q, R, S, and then T. Note that the QRS complex may not contain a Q wave and an R wave and an S wave in every lead. It depends on which lead you are looking at. So, if the first deflection after the P wave is a negative deflection, that wave is called a Q wave. If the first deflection after the P wave is positive, that wave is called an R wave, and there is no Q wave in that lead. Just like the waves on an EKG are given names, The segments in between the waves are given names as well. The segment that will be most important for this topic is the ST segment. The ST segment always begins wherever the QRS complex ends, and the ST segment ends where the T wave begins. It may not always look like this, it may not always be normal, but wherever the QRS complex ends, that's where the ST segment begins, and wherever the T wave begins, that's where the ST segment ends. When we discuss EKG findings of ischemia and MI, we divide the findings into three categories: ischemia, acute MI, and old MI. Ischemia is represented on EKG by T wave inversions or ST depressions. Acute MI is represented by ST elevations, and old MI is represented by Q waves. Let's take a look at this a little closer. Here's an example of a normal EKG. Note that the T waves are upright, the ST segments line up with the baseline, there are no ST depressions or elevations, and there are no Q waves. Now, let's take a look at some abnormal EKGs. Ischemia is represented on EKG by T wave inversions or ST depressions. Let's take a look at the inferior wall. To look at the inferior wall, look at leads 2, 3, and AVF. Let's take a look at lead 2 and just name the waves. First, we have a P wave, followed by an R wave. Notice there is no Q wave in this lead, followed by an S wave, followed by the ST segment, followed by an inverted T wave. Now, let's look at the other leads that look at the inferior wall. Leads 3 and AVF. Lead 3 has an inverted T wave, and lead AVF has an inverted T wave. So, we have T wave inversions in leads 2, 3, and AVF. This is an example of inferior wall ischemia. Another sign of ischemia on EKG is ST depressions. This is an example of a normal EKG. Normally, the ST segment should line up with the baseline. If the ST segment is depressed, that can be a sign of ischemia. Here, in leads V3 through V5, the ST segment is depressed below the baseline. This is an example of anterior wall ischemia. The next stage of abnormality on EKG is acute MI. Acute MI is represented on an EKG by ST elevations. This time, let's take a look at the anterior wall. Let's start in lead V1 and look at the ST segment. Here we see that the ST segment is elevated above the baseline. The same is true in lead V2 and V3. This is an example of an acute anteroseptal MI. The final stage of abnormality on EKG is old MI, sometimes called completed MI. Old MI is represented on an EKG by the presence of Q waves. Let's take a look at the inferior wall. To see the inferior wall, look at leads 2, 3, and AVF. In lead 2, we see a Q wave. The same in lead 3 and AVF. So, we have Q waves in leads 2, 3, and AVF. This is an example of an old inferior wall MI. Let's review. Leads and walls. Leads 2, 3, and AVF look at the inferior wall of the heart. Leads V1 through V6 collectively look at the entire anterior wall of the heart, but we break these down into subsections. V1 and V2 are the septal leads. V5, V6 1 and AVL, the lateral leads. 3 stages of abnormality on EKG: ischemia, acute MI, old MI. Ischemia, represented by T-wave inversions or ST depressions. Acute MI, represented by ST elevations. And old MI, represented by Q waves. The only way to get good at EKGs is by practice. Look at every EKG on every one of your patients. Look at each wall and look for the patterns we spoke about. One of your patients out there is having a heart attack. Your job is to identify them and save their life.